Treatment option number 1 for treating and eliminating pain that's caused by trigger points causing low back or hip pain. As you can see by this illustration, trigger points in the quadratus lumborum muscle can refer pain into the lateral hip, superior or inferior to the trochanter, around the anterior portion of the thigh, superior to the inguinal fold, and down into the lateral thigh. To best treat the muscle of the quadratus lumborum, we're going to use 2 treatment options for this sequence. And to set up the table, first I'm going to use this body support system. I'm going to break it into 2 pieces, and then I'm going to leave a space for the patient to put their arm in the space. If you do not have one of these, it could simply be 2 pillows, a larger or more full pillow, and a thinner or less full pillow. Then we're going to place the sheet over the treatment cushion. Okay, we're going to get our patient to come onto the table. Treatment position number 1 has them placing their arm into here. Scoot yourself on up there, good. If necessary, we want to support the head and neck. We want to see that they're able to be fully supported by the table. Then what we want to do is this affords us the ability to have them raise the arm overhead, give that a rest, and you can see it opens up a little bit of the space just above the iliac crest and the 12th rib. Then we want to lean our hip against the patient, and if you don't feel comfortable with that, we can use a barrier. I'll place a barrier here between myself and the patient. I'll lean my hip therein and bring their leg back toward me. Drop that leg down loose. Again, here I'm maintaining contact with my hip so that I can stabilize them, either anterior or posterior translation. Then we can find the iliac crest, and we could ask the patient one of 2 ways to find the quadratus lumborum. You can say, ahem. Ahem. A little longer, ahem. Okay, the quadratus lumborum stabilizes the thorax during forced exhalation, or we can ask them to do an active hip hiker. Can you raise this crest up? Great, drop it down. One more time, and drop it down. So I've located by palpation the fibers of the quadratus lumborum. I've got my barrier here. I can lean my torso against the patient's glutes. I've located the region. Any discomfort for you here upon this location? Yeah, okay. Then we have an area needing to be treated. Gently place the elbow and gently apply trigger point pressure release. Good breath in. Exhale. What number am I causing you of discomfort? 2. Discomfort of 2. Remember, we always ask, what is the level of discomfort on a scale of 1 to 10? We do not want to go over a 6 relative to each person's discomfort. Got it? So that would be just 1 treatment position. We can vary this position while we're treating. Go ahead and do another few hip hikers. 1, let it go loose. 2, let it go loose, and 3. I also could bring the top leg to an anterior abducted position, which affords me the ability to bring my arm back and treat the posterior fibers. Bring the leg back again. Again, I'm leaning in the hip from here. Can you sit up on your butt, bring your legs together, sit right here on the table. And then the second position in this sequence brings this cushion system into a much higher pile. I've left the indentation here for their torso. I'm going to cover that back over. We're going to have you go ahead and put your hips and waist right in the middle of that cushion system. Scooch up and over. I'm present right here. Drop yourself down. This again is an advanced position, which we do not want to use with someone who may have some true and genuine disc pathology. So then from here, we want to, of course, warm up the area with our gentle effleurage or lotion. Then we can very carefully use gentle, guided trigger point pressure release. Can you try that hip hiker? Good. More difficult to do, isn't it? And try it again. And drop down. Can we bring this leg into extension? Good. And if that's too difficult, we also could put in a pillow here to support their leg. But that would be some treatment options. Now, to get out of this position, I recommend the patient rolls forward. See where the edge of the table there is. Great. Come on up to all fours. Great. Can you do a cat back in an old horse? Hunch up and hunch down. Then come on and sit on the table. I'm spotting, and we can exit from that position. So there was our treatment sequence for quadratus lumborum causing hip or low back pain.